I now want to recognize the lead author of this legislation, the Chairman Emeritus of our committee and the champion of health care for many decades, Mr. Dingell.
Mr. Chairman, I thank you. I commend you for this hearing, and I thank you for your leadership in the matter. I also thank you for your kindness to me and for the gracious comments that you have made about me. Mr. Chairman, I have enjoyed many years as a member of this wonderful committee. The jurisdiction of this committee has allowed us to leave our mark on the history of this nation and on numerous and important pieces of legislation. Today, Mr. Chairman, we're about to begin consideration of what I strongly will believe will be one of the most consequential bills ever before this distinguished committee. Indeed, H.R. 3200, America's Affordable Health Choices Act of 2009, will forever change our economy and will make us a much stronger and healthier nation. Mr. Chairman, the task at hand is no easy undertaking, but we must act for the health of our nation, for the health of our nation's economy, and for the well-being of our people, and for the competitiveness of American business and industry. Every day, American families confront the crushing health care costs that are slowly taking away the security and stability that comes from having health insurance. Furthermore, the costs of our overall health care system are spiraling out of control and are on a path to bankrupt our families, our businesses, and our government. The moral case for health reform has been made since well before the first part of the 20th century, when my father was a member of Congress. Now the economic crisis generates a fierce sense of urgency to act, and the crisis worsens every day that we do not act. And I would point out that now the need for health care is exacerbated by the fact that our businesses are being made uncompetitive by this situation. So what follows? Premiums will continue to rise if we don't do something. And if we don't do something, Americans will continue to pay more for less generous health care coverage that will worsen every year. Businesses will continue to be less competitive. Fewer employers will offer health insurance to their workers. The number of Americans delaying coverage or going without coverage altogether will continue to increase. And health statistics of American people will get worse. If we do not take action, the cost of the average employer-sponsored health insurance plan for a family will reach $24,000 in 2016. This is an 84% increase over 2008 premium levels. Under this scenario, we estimate that at least half of American hospitals or households will have to spend more than 45% of their income to buy health insurance in 2016. Nearly 1 in 4 Americans under age 65, some 64.4 million people, will spend more than 10% of their family income on health care in 2009. The vast majority of these people, 82.6%, have health insurance. We have the opportunity and, frankly, the obligation to prevent then the next great economic catastrophe. Just yesterday, we learned in Michigan that the June unemployment rate for our state was 15.2%, the highest in the nation. This does not bode well for state and local governments, and it has left numerous citizens of Michigan wondering how they're going to make ends meet. Unfortunately, in most cases, each job loss means the loss of access to health care. H.R. 3200 offers uniquely American solutions to our health care crisis and addresses the insecurities related to health care felt by most Americans. The burden of the cost of health care has been placed on the economy and the competitive disadvantage experienced by our businesses. This legislation will assure stability for all citizens of Michigan and for all Americans. H.R. 3200 means stable coverage that cannot be taken away from life's ups and downs, stable costs that will not eat away at Americans' paychecks and will not put coverage out of reach, and stable quality so that individuals can get the needed treatments when they need them and from the doctor of their choice. I understand that many of my colleagues are not yet satisfied with all the provisions of the bill. This is why we have the markup process, so that we can work together to produce the best possible piece of legislation. While we may not agree on all of the particulars, I sincerely believe that all of us in this room, on both sides of the aisle, want to reform our health care system. I urge us then to listen and to work cooperatively together to get this bill ready to go to the floor by the end of the month. There are big problems facing our nation and its citizens. There are big problems facing this committee. Our solution must be just as big. We cannot shirk the heavy responsibilities we bear. We must meet this challenge. The American people deserve nothing less. Thank you, Mr. Chairman.
Thank you very much, Mr. Dingell.